Hey, I'm David LaValle.
And I'm Gina Hall.
We are both in our second year of the Developmental Service Worker program at Algonquin. Our role as developmental service workers is to provide the support and ongoing care to individuals whom have developmental disabilities.
So what is dual diagnosis? There are many common developmental disabilities out there, but did you know that people with developmental disabilities also have a high prevalence of mental illness? Some researchers estimate a staggering 33% of people with developmental disabilities also have coexisting mental health issues. This is called a dual diagnosis. We are referring to dual diagnosis as an individual with a developmental disability and a mental health issue combined.
For the purpose of this video, we will be discussing specifically dual diagnosis of Down syndrome and depression.
The prevalence alone for depression is estimated by the American Psychiatric Association at around 7%. The estimation in Canada among adults is 8%. This is when the biopsychosocial model should be considered. We now know that adults with developmental disabilities are less prone to mental health disorders because of their biology, psychology, and social factors compared to those with pre-existing developmental disabilities.
The prevalence of a developmental disability and depression as a dual diagnosis hasn't always been clear. A recent comprehensive study suggests that 10% of people who have developmental disabilities also encounter a bout of depression throughout their lives.
This is super important for medical professionals to take into consideration. It means throughout the day, if you see 100 people who have various types of developmental disabilities, 10 of them may have clinical depression.
So what is the problem? Persons with Down syndrome and undiagnosed depression. Symptoms can be mistaken for stereotypical behaviors. Down syndrome and depression can result in more frequent problem behavior and lessen a person's quality of life.
One of the more commonly known developmental disabilities is Down syndrome. Along with the disorder, there are many documented symptoms that are now deemed common for the disorder. Symptoms like sleep disturbances, anxiety, and declined social skills are all common in individuals with Down syndrome, but are also symptoms of depression. This common mistake is known as diagnostic overshadowing.
Down syndrome and depression do share certain symptoms. For this reason, it may be harder for professionals to distinguish depression with someone who has Down syndrome.
So how do you identify this? As a nurse, it would be beneficial to take note of behavior and any changes that are going on, to observe and report variations in consistency. Changes in behavior should be reported to the healthcare team so that everyone can decide whether or not the behaviors are normal or not. If a person with Down syndrome communicates about having feelings of sadness, thoughts of death, noticeable changes in weight or appetite, unusually aggressive or withdrawn behavior, then these changes should be taken seriously and addressed promptly. It should never be assumed that these symptoms are stereotypical symptoms of Down syndrome.
In Ottawa, there are specialized services for people with dual diagnosis. Adult services are provided by the Royal Ottawa Hospital Dual Diagnosis Consultation Outreach Team. Child services are provided by the Children's Hospital of Eastern Ontario's Dual Diagnosis Service. Both services are best accessed through family physician referral. Contact information for Royal Ottawa Dual Diagnosis Clinic is 613-722-6521, extension 7141. Contact information for CHEO Mental Health Clinic is 613-737-7600, extension 2496.
The most important thing that you can do is to be aware and to spread awareness. Tell your colleagues about the importance of noticing changes in behavior and the impact of dual diagnosis if left untreated. Advocate for people with disabilities and ensure that symptoms of depression are not being overlooked. We as healthcare professionals are responsible for ensuring high quality of life for the people we care for, and awareness is the first step in reaching this goal. Thanks very much.